we would like to hear from you. How do we navigate to take care of our mental health during these trying times? Because there's like one trauma on top of another trauma. So we would like you to give us some insight on how we can take care of our mental health, not only for ourselves, but for our families and our loved ones.
Well, there are a couple of things, Mike, I think we need to look at. First and foremost, since many of us may have the luxury, even though we complain about it, the luxury of working at home, I think it's important for us to maintain a schedule and maintain a self-discipline, which means getting up every morning at the same time, hopefully early, going to bed at the same time, hopefully not too late, making sure that we're not overindulging in sugars, carbohydrates, drinking, too much alcohol, which many people are doing right now because of COVID, because of all of the things that we're going through, because of the assault on people of color, police brutality, and so on. But exercise is important, meditation is important, prayer is important, and staying connected to our families, being able to talk to our spouses, being able to check in on other family members. Social distancing doesn't mean social isolation. This now more than anything. And I'm also very concerned about our children. Our children are really going through it. They are anxious, they are depressed, they're having panic disorders. They're not learning the way that they really, should be learning or should be taught, because this whole online thing is really, not only are the teachers having a hard time teaching online, but the students are having a hard time learning online. And you have to think about young people. Isn't it the most important thing for them now are peer relationships? Mm-hmm. That defines who they are. It gives them the rocket fuel to be able to individuate and see who they want to be. It teaches them social skills, these peer relationships that they have in school, how to interact, how to date, how to come out, if they're part of the LGBTQI community. All of these things are now gone. And then we have an environment where, it is a very divisive nation. There's a lot of fear, a lot of hate, certainly no leadership as far as the federal government, literally. And it's up to the states, of course. And more than anything else, we as the dads, we as the parents, have to, put on that happy face. We have to be the pillars of strength. We have to be the role models. We have to keep it all together. We have to keep it together for work. Now we have to keep it together for home more than we've ever done before. And so I think it's important for us to not only connect, but to look at therapy, to look at counseling, to look at support groups, to look at, a Real Dads Network, to be able to talk about our, what's going on in our lives. And it's not about complaining, but it's about sharing empowerment strategies. But we can't keep it all inside the way that we typically do as men, but especially as Black men.
Thank you, Dr. Jeff. So, that leads me to my question this evening. You gave us a lot of great insight, a lot of great recommendations that we could use for mental health. So when we think of therapy, especially in the Black community, that is not something that is celebrated. So if you can tell us, why is therapy important? Why would you encourage us to go for professional help in counseling? Because I could say, I'll talk to my buddy, I'll talk to my wife, I'll talk to my bro, but why would you recommend, if we have the opportunity, to get professional help and to get professional counseling?
Well, I think if you have the right counselor, the right therapist, the right life coach, as much as our spouses are supportive, families are supportive, sometimes they don't always tell us what we need to hear. They tell us what we want to hear. I don't want to hear it's going to be okay if in fact it may not be okay. I don't want to hear that, well, you didn't do so bad if in fact I did. You know, I want to find out from a therapist, someone who is objective, someone who's not going to be personal with regard to trying to make me feel better. I want someone who's going to give it to me straight, no chaser, because that will help me to be a better person. And that's what we do in therapy. It's really about, yes, we offer support. Yes, we offer love. Yes, we offer emotion. But at the same time, we do a disservice to our clients or patients if we don't tell them the truth. And so that's the most important thing about therapy. You hear the truth. And in hearing that truth in a constructive way, that helps you up your game. So you don't necessarily have to see a therapist because you have depression or because you have anxiety, you know, or some other issue. You could see a therapist only because that person you can talk to, that person can give you information that can only up your game and help you, you know, divest yourself of a lot of the things that are keeping you down. But certainly if you have an anxiety or a depression or something that may be a real mental health challenge, you know, I mean, if you're driving a BMW and something's wrong with the right tire, you're not going to just keep on driving it. You know, you're going to take it to a specialist. If you're having, you know, hypertension, you know, you're not just going to try to deal with it yourself, though sometimes we do, and with disastrous results, and sometimes we do okay, but you're going to go see your physician or health provider and get the right treatment so you can keep on going. Well, of course, the same thing goes with your emotional health. You know, if you have something, and let me tell you something, I'd rather have a sore shoulder or a bum leg than have a real psychological issue. Because think about it. When you're worried about something, have you noticed how exhausted you are afterwards? Have you noticed that you just can't focus on the things that you need to do? Have you noticed how you're just not going to get a good night's rest? I mean, I could take an aspirin for a shoulder, but what am I going to take, you know, if I have a real mental health challenge? So it's about the talk therapy. And sometimes, you know, if it's something that's really serious, like bipolar disorder, it's important that we be placed on the right medication so that we can have, you know, as productive a life as possible. So why not use those things that are out there for us? You know, those things that as therapists that we study for years and years and years and have that experience of working with patients and clients for years to help you so you can help yourself. And that's why it's important. And there should be no shame in your game. And I know there's a real stigma about it, but I can't tell you the number of people of color who now utilize therapy, send their kids for therapy, who talk themselves, you know, to a therapist. Now, granted, more sisters are going into therapy than the brothers, but eventually the brothers are going in. And I can't tell you how many sisters give an ultimatum to the brothers, to their husbands or spouses or boyfriends or whomever it is, or even the same-sex partner, and say, unless you go to therapy with me or you get your own therapy, the relationship is over, because they know that's the line right there. If you're not willing to work on that relationship and you're not able to accomplish it by yourself, and you know you need professional help and you're not willing to do that, the relationship is over. And they use that as the measuring stick. And we also see that so many people now are doing premarital counseling, which is really helpful because it helps you align your goals and values. And if they're not aligned, where you can make compromises so you can work together and everything is on the table before you begin. So therapy, you know, and I'm not just saying this, you know, because I make a living from it, you know, and that I have 6 kids and I have to buy them a new pair of shoes every week. It really is about how it can enhance your life.
So Dr. Jeff, I have a question, and then I'm going to open it up to the other brothers if they have some questions also. I would like you to unpack or help us with the trauma that we might have experienced as children and how it can affect us in adulthood. Also, maybe it's two different questions about our conscious and unconscious, how it affects our choices that we make.
Right.
So the first one, that might be two questions, but the first thing is how our trauma that we might have experienced in our childhood affects our adult life.
Well, actually, the two do align.
Okay.
Those two questions.
Great.
Look, the bottom line is we've all had childhoods, and some of our childhoods have been more difficult than others, especially as men of color, because we've had to deal with racism our whole lives, each and every day. That's an extra burden for many of us. It's made us stronger, and that's why we're here tonight and can talk about this. For others, it's destroyed us, but it's something that we all experience. But everyone experiences a childhood, and in that childhood, it really does. There are traumas, there are positive experiences, there are negative experiences that shape who we are and how we see the world and how we behave with other people. For some of us, some of those traumas have set us on a course or a path for success, but there are chinks in the armor because of those traumas. For others, it has caused them to have a life of pain throughout the years, and they're trying to get it together now or have not been able to get it together. That's why we see when there are so many people who are incarcerated, each one of those individuals, I guarantee you, I can give them a mental health diagnosis. I can give them a DSM diagnosis. So childhood, those things that happen to us, we carry it. We carry that emotional baggage into our adulthoods. You know, quite often when I used to check in at Delta back when people used to fly, they would say, "Do you want to check in any baggage?" I would say, "No, just my emotional baggage. That's the heaviest baggage I can carry." And so we bring that baggage, emotional baggage, into our relationships. We bring them into our experiences as adults. I often say that if you marry someone, it's not just you and that person, it's the four of you. What do I mean by that? It's you, the other person, their emotional baggage, and your emotional baggage. That's why people complain to me all the time. Well, I don't understand why my partner treats me in this way. I didn't do anything. And then I have to tell them, well, what is it that you represent in that person's life due to the emotional baggage that they have, right? You know, or how do you perceive your partner because of that emotional baggage?